We have Ron Patterson. Ron, let's talk about Lumen Photon. I have some amazing stories every week about how people are healed. Tell us some of the stories you have about people using Lumen for not only themselves, their pets, not only from athletes, but seniors, people recovering from serious illness, people seeing their pets, from their little birds to their dogs and cats and big horses. It really is an amazing technology, isn't it?
Yeah. Very simple.
Yeah. So what kinds of benefits are you seeing? Because we have amazing stories literally every week that we get from people that say, this healed me. My vision came back. My joints are healing. My pain's gone. My skin condition's better. My, seizure disorder or mood problems or sleeping problems have gotten better. My peripheral neuropathy's gone. It's just amazing. Post-operative recovery. Every post-op recovery room should not be trying to give people shots of narcotics after they recover from surgery. They should be slapping a lumen pad on their surgical sites and sending them home with one so they won't need all these darn pain pills or anti-inflammatories that will interfere with collagen regeneration. Right?
Yep. So if they have diabetic neuropathy, this will really turn their life back, give it back to them. They just have to use the lights on a regular basis, and that's it. Because it will restore the circulation, lymph function, all that, so they don't really have the symptoms as long as they use this on a very regular basis like that. It takes care of that issue. They can have a regular life as opposed to worry about, do I need to get another shot right now?
Yeah, exactly.
Yeah, it can be really difficult, but once they see what's happening, this is one of those where people say, I don't want to do this anymore. I want to get healthier.
Right.
And it's not that hard. So it's I think the hardest one for people. I like my ice cream or something like that. Well, can't do that.
Yeah. Give an example. Let's start off. If people don't start from toe to head instead of head to toe.
Yeah.
We have people that have chronic onychomycosis. They start taking our nutraceuticals like NutriMed, Nutridyne, Silver 100, applying them directly to the toes of Nutridyne. They start using Lumen Photon and their fungus infection goes away. Peripheral neuropathy, they take copper Regenemax, Minerals Plus, phospholipids, Neurogen, Nutrifos, and Omega Supreme Krill. Take BioLVR and ultrathymine B1 to reverse neuropathy, and guess what? Add Lumen Photon. Boom, over 3 or 6 months, the neuropathy's gone. We see it when we go up the legs, vascular problems, continuous, let's say, restless leg syndrome, venous insufficiency, varicose veins with chronic pain, gone. Okay, literally, if you take our nutraceuticals like Vein Away, things to help the vessels like cell defense, things to help like ellagic acid from the terminal of Chibulia, then you add Lumen Photon and the vasculitis disappears. Then go up to the knees. People have chronic arthritis, patellofemoral syndrome, ligamentous problems, torn menisci, dry joints. So they're getting osteoarthritic or inflammatory joint changes, rheumatoid, scleroderma, mixed connective tissue disease. Lumen Photon, pain gone, tissues healing, circulation improving. Chronic interfascial adhesions from the tensor fascia lata, the IT band, etc. You start applying, getting deep tissue massage, take our enzymes and Flamex, take seroflozyme, which is serapeptase enzyme, add Lumen Photon, and you get healing. Moving up to the pelvis, chronic pelvic pain, period cramps, inflammatory bowel disease, chronic diverticulosis. Slap the Lumen pads on, take our nutraceuticals, and boom, you get better. Working up toward the chest, chronic bronchitis, asthma, cystic fibrosis, chronic obstructive pulmonary disease, fibrotic lung disease, including fibrosis caused by asbestos, and then chronic heart disease, calcified arteries. Take our vitamin K2, cardiovasc, gamma E+, Omega Supreme Krill, VascuCare, coenzyme Q10, CoQ10 ubiquinol, ellagic acid, blood vessel walls healing, calcium score changing, circulation improving, microcirculation improving. They take copper Regenemax to restore the copper, zinc, superoxide dismutase in their artery walls and their mitochondria, along with Minerals Plus, and they heal with the Lumen Photon pads over their chest. Moving up to the neck, B-scan ultrasound shows plaque. Person is throwing off little micro plaque emboli to the brain, so they're getting small TIAs. We have a high-speed CT scan done that indicates that parts of the brain have had small micro strokes. You start using the lumen pads over the head and the neck, and guess what? The calcium score changes, the arteries clear up, along with taking your enzymes such as lumbrokinase, nattokinase, and they start to heal. So literally from head to toe, scalp problems, balding, tinea capitis, fungal infections, dry skin, inflamed skin, psoriasis, burns. If you get a burn, you can put the lumen pads over. You go and get a bad sunburn, slap the lumen pad on your burnt shoulders, and guess what? It turns the burn off. You slap on curcumin cream, spray it with silver 100 to stop infection, the combination of the silver 100, curcumin cream, and slap the lumen pads on. And if you've got a really tender joint, you can put a gel ice pack on the, say, arm or leg or back or wherever, with a dry terry cloth in, between the body and the gel pack, so the gel pack is not going to give you a frostbite. And then you can put the lumen pad over top of it, and the light goes right through the gel pack to do light therapy while the skin and the tissues are being cooled. That is really neat, isn't it?
Yeah, it is. Yeah.
Yeah. Yeah, yeah. I just find this just amazing to me. It really is. So, and we have pets. We have pets with chronic problems. They develop aging 7 times faster than us. So, unless you're getting a smaller dog, like my dog is a champion breed West Highland White Terrier that has long life in his family line. He's 14 years old and still acts like a puppy. But you get big dogs, and they deteriorate very quickly, and many small dogs. You start using lumen pads on them. Just sit the pads in their doggy bed. Sit them on it. The dog's going to say, man, this is good. I'm not going anywhere. They get a sore hip, a sore back. They're getting kidney stones because some dogs are prone to form kidney stones. And you'll notice that you have adults and they're forming, losing renal function. Slap lumen pads over the area of their back. Take our nutraceuticals to stimulate regeneration healing. I like to use both the lumen and the micropulse. I tell people, slap the micropulse on, put your lumen pads on, bam, you're going to get better. And we already have cases. I had a diabetic last week. He'd been on 6 months of ultrasound B1. We're giving him a micropulse now. He's going to regenerate his kidney function completely. His GFRs are already returning to normal. Which means people say, well, that can't happen. You can't reverse heart failure and kidney dysfunction and loss of kidney function or dementia. Hogwash. Total hogwash. And that's because they're uninformed people who don't understand living pathology, which is functional medicine. Plasma physics, biochemistry, intermediate metabolism, and the informational side, which is where lumen raises what's called a signal-to-noise ratio and literally heals the tissues by talking to the genes and the epigenetic control of your cells. That's what's so amazing. And I got my lumen pad right here. I tell people, if you're going blind, take our nutraceuticals like Vision Max, Can C, Cell Detox, Glutathione, Omega Supreme, Krill, Neurogen, Nutrifos, Copper Regenemax, and Minerals Plus, Vitamineral Max, Ultrathymine B1, and Vein Away, enzymes like nattokinase, reduce blood viscosity, and cell defense, anti-inflammatory, and slap the lumen pads on either. And you don't have to put it right over your eyes. You can put it on your temples. You can put it over the top of the head. It'll go through 12 inches of skull, brain, eye, retina, whatever. You got headaches, migraines, you want to turn a migraine off, put a B12 under your tongue, bite into a CoQ10 ubiquinol, open up or swallow a BioLVR capsule, a folate power methyl B12 tablet under the tongue, and slap on the lumen pads, and in 15 to 20 minutes, your headache is gone. That's how fast it goes. Amazing, isn't it? And mood disorders. Depression, anxiety, schizophrenia.
Treating horses. We actually had to deal with horses with colic.
Yeah.
That's really deep. All right.
Yeah, it is. Yeah, horses with colic. And imagine, and I'll tell you, the horses are smart. They'll shimmy up sideways toward the lumen pads when you have them in their stall, right? And they'll say, don't move my pad.
Yeah. Well, the vets in our area around here all end up getting pads for that reason.
Exactly. And we have John, one of my favorite guys. John is a miracle worker. And actually, John, your Nutridyne is amazing. I literally, did you ever see the movie The Big Fat Greek Wedding, where the old guy was literally, spraying Windex on everything? He thought Windex was a treatment. Actually, they should have substituted for Nutridyne. And literally, Nutridyne resurrects mitochondria, detoxes the body from virtually everything, raises the redox of tissues so your stem cells can regenerate your tissues. We see literally Nutridyne helping people literally reversing dementia, reversing heart failure, reversing aging, detoxing the body from halides, which, by the way, are feminizing the population. I call it the Bruce generation. Do you like that little play on words?
Yes.
Bruce generation. And we can also test the efficacy. In fact, I just got the new software about a month ago for the Bioplasm Expert Pro and Clinical, which is the most advanced diagnostic scalar machines in the world. And we, of course, have the QRMA. I just got a call from our scientists in China that we now have a new upgraded version of the QRMA as well. And then what these do is they look at the bioplasmatic body. We can actually test in the Bioplasm Expert Pro and Clinical the actual frequency spectra in terms of its efficacy for reversing to normal any disease or any dysfunction in any body system. That can be done today, not 2030 or 2020. Today we have that technology. And so we can actually test the efficacy versus the ability of the body to reverse the bioplasmatic imbalances. And so I've added Nutridyne to virtually every protocol, whether it's chronic lung disease, sinus problems, peripheral neuropathy, congestive heart failure, dementia, getting rid of stealth pathogens, diverticulosis. I just can't see a place where the use of some dosage of Nutridyne, even pregnant mothers, to make sure that their babies have a well-developed brain. We know that Nutridyne will raise the IQ of people. We know that it will reverse and get rid of pathogens that cause plaque around their teeth and in their arteries. We know it stops the viruses from breaking out if they get a start of a herpes simplex or zoster infection we call shingles. It can stop it cold better than famiciclovir that costs over $550 for a 5-day course, which is only 87% of the virus can be eliminated in the cell, and the regular acyclovir is only 14% of viral replication stopped inside the cell. Nutridyne is 100%, will kill all known pathogens. And so I tell people, whether you're trying to fight cancer, stop autoimmune diseases, stop stealth pathogens, because your bugs are in your body are unbelievable, trying to change your genetics and digest you, in other words. So, and kudos. I mean, this really is amazing stuff. As I tell people on the show, I have a big bottle of Nutridyne here, and I'm usually taking somewhere around, well, how many do I? A lot. I take somewhere around anywhere from about 60 to 100 drops a day, is what I do. That's a lot.
Yes, it is.
So there's no self-respecting pathogen going to be able to exist in me.
Another testimonial would be our missionary in Zambia, Brother Fisher. He uses about an equal amount, and he hasn't had malaria in many years. He is used to get it all the time, but he doesn't anymore. And he
now, here's something else that people should be aware. The malarial drugs that they use now that we call chloroquine-resistant malaria, and the drugs that they use like Fanzidar, these drugs tell you right on the black box warning for the drug that within 6 weeks you'll start to develop renal dysfunction, retinitis, where you start to see things turn yellow, and it damages the retina and the peripheral nerves and your brain after as little as 3 to 6 months. So people need to realize that's why the natives in South America go to witch doctors to get native herbals to try to help, but Nutridyne is far more effective. So if you're taking a high dose and you're going to a place where there's chikungunya, break bone fever, or malaria, or these other nasty pathogens, and believe me, they're everywhere, and they're more resistant than they ever were even half a century or 20 years ago. Absolutely. You want to be a Nutridyne. So if you're a missionary, you need a flat of this stuff, not only for yourself, but your villagers, because when we sent off, remember back in January, a whole pile of flats to Liberia, Ragma Ministries, not one of the ministry people or the villagers that received it got Ebola. Not one. That's pretty exciting. And remember now, in your future, the globalists are planning on releasing super plagues, and they want plausible deniability. It's part of the process of changing your cash to get rid of real physical money so they can have biometrics. And the 2030 agenda, which is world population reduction, which is tied to cap and trade and the globalist agenda, they want to rework the world so that 30 or 50 years from now, they have a grown population of humans that can't reproduce or can only reproduce by licensure. They want to form a unisex population that's sick and dying of plagues, starvation, and other problems, mainly toxins in the environment. And most people don't realize most of the biotoxins are feminizing. They lock onto the estrogen receptor and feminize females and males that cause disturbance in brain pathways, reproduction, and even induce cancers. So people should realize that Nutridyne is the most powerful detoxicant for all halide toxins, which other than radiotoxins are the worst in the world. So it's pretty amazing, isn't it?
It really is. Works so well. We get testimonials all the time from those foreign fields where they're using it, where they really don't have any other things that they can do that's effective, and they use it. They've used it a lot with those who are having diabetic amputations and reverse those. So those missionaries are really getting a great deal of use out of our Nutridyne. They're really putting it to use. It's saving lives and it's saving limbs all over southern Africa.
Exactly. Now, well, one of the things I tell people to do is that the medical system does not teach doctors enough intermediate metabolism, infectious disease, bioplasmatic physics of what the body in a living system is. And remember, the primary thing that a living cell is an informational system. And it's dependent on what's called electron transport and what's called a high redox state or high energy state. When you have a high density of electrons created by healthy mitochondria, you generate ATP and NADH, and then you translate the signals to create the enzymes that create all the metabolic pathway conversions and all the structural proteins for cells and tissues. Give you an example, and I'm going to use a little imagineering here. Let's imagine a play where we're going to call these Everlast domes, and let's say I created a dome that was going to cover, say, 12 acres. And these 12-acre domes are created by nanotechnology, so I can create a 1.3 atmosphere with airlocks, and you can go through an airlock, drive your car through, get inside the dome, and it's going to have 100,000 parts per million carbon dioxide, so you can grow lots of food. It's going to have 30% oxygen. It's going to have trace amounts of specific gases like helium and hydrogen sulfide, so that it'll stimulate the specific enzymes in your body. People are going to have in their water supply a significant amount of monatomic Nutrimedine that's at point of use, so they're not only bathing with it, which I bathe with, but they're also, like I put it in my pool, they're also going to be able to drink it, and so that it's going to maintain mitochondrial function, which improves what's called mitochondrial protofaction. And that fancy term means you get old and damaged mitochondria, you retire, get rid of. You create new mitochondria. Cells and tissues will live considerably longer. This will be like creating conditions of the antediluvian world where human beings, just with mineralizing their body with NDMEs and the proper nutraceuticals and proper organic food with all the mineral content, they'll live hundreds of years without any need for drugs. That's where I see things going. At some point, we're going to be able to fix the metabolic pathways, reoxygenate the body, and create an environment for super. And welcome back, and I guess we have Bob Vineyard. Bob, you're there.
Yes. Hi, Dr. Bill.
We tracked you down. Of course, I call a lot of time when we're juggling live radio, it's like juggling what I call flaming machetes with razor-sharp blades. You're getting pretty good at it, actually. I haven't had any major cuts lately. Yeah, because we try to track down people. We want to make sure people are not so busy that their mind is able to focus and give us the best information, because here at Nutrimedical, we're very unique. We provide solutions on each realm of people's lives to empower them. We want to empower them with non-toxic water, the means to regenerate their bodies through what we call the 4 steps of the power of ones: oxygen, NutriMeds, energetics, scalar technology, and stem cells. We want to empower them with the 4 steps of repairing their bioplasmatic body, which is detoxing the body, not exposing to more toxins, fixing the bioenergetics, then fixing the micropathology, getting rid of stealth pathogens, which you can't if your body's toxic, and then repairing the deficiencies of the enzymes and jumping gene defects or removing biotoxic blockage to metabolic conversion, and then finally stimulating the signal and the strength, like we talked about with Micropulse director Dr. Bob Dennis and Lumen Photon and other technologies, and applying mild hyperbaric oxygen with ozone therapy as well as oxygen augmentation. And when we do this, one of the most important principles is don't put more junk in your body. And the worst place possible is junk in your water. And the problem is more and more industrial waste, more and more biological chemicals, all the way from, things like birth control pill, cardiac drugs, chemotherapy, doping agents from microchip factories, industrial and agricultural runoff is getting in the biosphere. They did a study in Washington State, I think it's now about 12 years old, and it's even worse now, that the amount of JP8 jet fuel was virtually contaminating all mothers in Washington State in their breast milk, because you can actually take a look at the high-pressure chromatography spike or peak that identifies directly that it's JP8 jet fuel. So having jet fuel in your breast milk is probably not good for baby. Having high levels of halides like chloramines and other attachments to your amino group of your amino acids is not good. Having DNA adducts of various toxic chemicals to your DNA, so it causes DNA breaks when your cells are trying to replicate, is probably not good. I mean, being sarcastic, anybody who tries to defend this is a suicidal idiot. And unfortunately, most doctors are not even trained to reach the idiot status because they're so ignorant. They wallow in their ignorant status and think that somehow they're all-knowing when they're not. And I find it extremely disturbing for someone to call themselves a health professional that doesn't start off with basics like, is your water clean? Or they flog a water system because they pretend they're a pseudo-water expert, and it isn't clean. And water contains hundreds of biotoxins from heavy metals and radiotoxins and endocrine disruptors and so on, and they wonder why we are developing what I call, as I mentioned in the last segments, the Bruce generation. What do you think of that?
That's a good one, Dr. Bill. I really like that, and it's what you speak of is so profound, because the amount of pollution that's in our biosphere. I mean, the fact that this stuff, rains down from the sky, gets into the atmosphere, gets into the hydrologic cycle, gets into all the contaminants that get in the air. They rain down on the food crops. They get in the soil. They end up in the plants. They end up in the food we eat. They end up in the cows that eat the food that eat the grass. Right. We eat the meat. All this stuff is a continuous bombardment of toxins to our system. They're all not human, right? They're all not food. And so our body responds to those things that are not human and not food as pathogenic invaders. And so that gets all kinds of responses going on in the body. And the one thing you can't control your air, you can't totally control your food. One place in life that you're able to exert influence that is profound in relation to anything else that you do is the water you drink. And right before you consume the water is the time to purify it to the highest degree possible. And so the BEV systems that we saw and make at Pure Water Systems are point-of-use water purification systems. And that means right before you draw off that water to boil your pot of noodles, right before you draw off that water to make a pot of tea, juice, coffee, whatever it is you consume, whatever it is, when you just go to the faucet and get a nice, cool glass of water, is that the water be 100% purified, remove all the toxins. And it's not so much, I always emphasize to people, water's not always important for what it brings. When people start talking to me about, my water needs to have minerals and all this, water's not important for what it brings. It's important for what it can take away. It's important for the detox in your body. Sure, it serves a function of lubrication, transportation, disposition, deposition, etc. But the important thing is the detox factor in our current environment, in our world today, is the importance of being able to help remove all these other chemicals that are being bombarded on us in the air and the food we eat. And so unless you're drinking pure water, you're just not going to get this detox to function in your body the way it needs to.
There's another function that I want to mention that is one that's ignored because most doctors and scientists, except people like Dr. Bob Dennis and I, are aware of it. And I didn't publish my research 33 years ago that I discovered called Phonon-Maser Biophysics, where I calculated out and managed to work out the energy transfer equations of the information of cell membranes to the epigenetic control of genes, called a Phonon-Maser operon. And this sounds really highly technical. What it means is water is a superconductor of the information in your cell to tell the cells in the DNA and the endoplasmic reticulum to make proteins and so on. And if you've got bad water that's got heavy metals and biotoxins, it's a very bad informational conductor, which means it can't translate the signals to your cells, your DNA, and your cell membranes, and I call it MEM-BRAIN. Because your membranes, if they're disrupted because you have bad water, can't send that signal to noise. You get a lot of noise in there instead of signal, and it can't turn on and off the right genes. So you end up with, for example, if you've got zinc, disruptive enzymes like mercury and zinc and copper by mercury present, or you've got depleted uranium, which is now in 37 states in the air. And by the way, you can filter out the air with our no air filtration systems, which we have. We are able to charge the air and the biotoxins up and filter it out now, so we have those available. You can also use ozone, and when you take ozone, either drinking ozone water or putting it in your it starts to grab a hold of the biotoxins too. So I tell people, first, clean your water. Don't alkalinize it, for God's sake. If you want to alkalinize it, and we do that already, adding 9 to 18 parts per million magnesium, you want to alkalinize it something simple like get a soda stream and get the flavorings that are, when you add a citrus flavoring that has no aspartame or Splenda or artificial sweeteners, it alkalinizes it. But if you alkalinize water that's not detoxified, you actually make those toxins more absorbable because you move the pH toward the pKa of the toxin and you amplify absorption by tens of millions of times. So idiots out there that say just take your water and alkalinize it, it'll make you better. These people don't understand chemistry. You have to detoxify water before you alkalinize.
Absolutely crucial, because as you describe, and a very good example of one of those chemicals that'll concentrate is arsenic. And I mean, if it's in the water and you run it through an alkaline machine, the water that you drink is going to have all that arsenic concentrated in it, and separated out from the water that they call the acid water. And as you say, it changes the pKa, drives that arsenic deeper into the cells at a faster rate.
Right.
So, absolutely pure water is essential that we be drinking. And no
other system does it.
You can get a distiller if you want to suck all the juice.
But
out
it doesn't.
of the
It does not even as clean. There's a lot of distillate that contains JPA, jet fuel, and volatile toxins that end up on the other side of the distillate, that the pure water system will pull out all the fluoride, all the radiotoxins, all the biotoxins. It makes clean, 100% clean water. Then you can put it through your soda stream. We have Fareed, and Fareed, of course, his dad, Sam Ibrahim, developed the Cardiovite, which is now we call Cardiovasc, which the Cardiovasc is our version in America that has the ginkgo biloba. I want to just, for all the people out there, and again, I speak to what I call I don't necessarily dumb it down, but I want to explain this. Your microcirculation is everything. When you get hypertension, it's because your heart's trying to compensate for perceived through various cardiac and hormonal reflexes that you don't have proper perfusion, which means delivery of oxygen, nutrients, and removal of toxins. And if that system is thrown off, sometimes a lot of the drugs that they use to try to fix it, actually, instead of lowering blood pressure, they actually lower perfusion, which compounds the problem and makes it more likely to produce tissue degeneration, autoimmune disease, biotoxin accumulation, and cancer. So a lot of the medications given, now I'll explain this. I recently discovered, pulling through the literature, the reason why there's a clutching down or turning off of the microcirculation, which creates a peristaltic wave that actually pumps your blood. Your heart is only what's called a primary wave, which means it starts a big wave like a vascular tsunami. But that wave starts a reflex where you get release of nitric oxide in the capillary bed, but you also have contractile peristaltic, like a swallowing wave you see in let's say a snake swallowing something, or in your blood vessels, when it actually moves things along in this peristaltic wave of contraction, a ring of contraction, is triggered by the mitochondria. And if you have free radicals there, it turns out in diabetes or syndrome X, which is present in anybody with vascular disease. Everybody with vascular disease has syndrome X. Syndrome X means you have insulin and leptin resistance, you have peripheral conversion of T4, not just to T3, but reverse T3 that blocks your metabolism, and you have a shutting down of superoxide dismutase because the syndrome X or metabolic syndrome binds copper. And you get a copper-2 chelate that basically is knocked out by whether you got mercury amalgams in your teeth or an imbalance of zinc and copper. So people with vascular disease have a significantly greater need for copper. They do need zinc, but their ratio of zinc to copper is much higher. They need a lot more copper. So we have copper sabacate, as well as taking our Minerals Plus and Vitamineral Max. They also have a higher requirement for activated fat-soluble thiamine, our ultrathiamine B1, and for activated B6. And the specific gene polymorphisms that lead to metabolic syndrome, which is present in all vascular disease, not just some. Everybody with hypertension, peripheral vascular disease, and so on, all have TRS or thyroid resistance syndrome. They're all basically hypometabolic. They all have a tendency toward dyslipidemia, oxidized fatty acids, so you need to remove the free iron, which, of course, cardiovascular is going to help, along with, of course, our NutriDefense, gets rid of IP6, gets rid of iron. You need to stimulate the liver to detox. You need to rebalance the autonomic nervous system so you don't have excess free radicals in the blood vessels because of sympathetic overdrive. You need to get rid of the nanobacteria, which, of course, has the aged garlic. You need to stimulate the microcirculation. And so it turns out when we do the things, for example, like giving copper REGENEMAX, Minerals Plus, omega fatty acids, and things like ellagic acids, malignoblock, and vitamin K2 to reverse calcification and protect the artery wall, cardiovasc is really cool because we're going to have the technicians on here shortly from Endopat and Endothelix, and I want to help these companies develop a mobile version you can use with your iPad, iPhone, or Android. And that'll mean you'll be able to put a little clip on your finger and look at your microcirculation in real time and keep a chart. Because your microcirculation is where it's at. And if the old test that they developed maybe 150 years ago is called the capillary Blanche test. I think it was developed by a Swiss or European doctor. You just press the nail bed and look at how many seconds it takes for you to get a return of the pink flash under your nail bed. And if your pink flash doesn't return quickly, there's something wrong. You're not releasing nitric oxide. You have no vascular peristaltic, activity in that bed. And the primary thing that's blocking it is a loss of SOD or superoxide dismutase and glutathione peroxidase activity. So we have things like carnosine to stop cross-linking. We have cell detox glutathione. We have Regenerex. And we have Nutri-Trala. But the most important thing you need to start with your vascular health is cardiovasc. Everyone with elevated blood insulin, fasting blood insulin, so if you go to your doctor and you want to know if you have hypertension or if you have obesity or dyslipidemia, the very first and most important thing you need is a fasting blood sugar, blood insulin, and blood glucagon. And you can get a salivary cortisol levels through Genova Labs, through directlabs.com, and it'll show you these things. Or even simpler, you can get a QRMA machine, which will actually show your bioplasmatic parameters changing toward normal. It's the simplest and most accurate physiological machine is a QRMA. And then, of course, the next step up is the Bioplasm Expert Pro, and the top one is the clinical. What the QRMA will show is it'll show you vascular spasm, it'll show you blood rheologic thickness or resistance to flow because of non-Newtonian fluid dynamics, and the cardiovasc reverses that. It actually starts to reverse it. Then you add our nanokinase and lumbrikinase. So it turns out that the primary thing that causes you to have your peristaltic spasm go away is copper zinc supporting a superoxide dismutase in your artery walls. Isn't that interesting? So ellagic acid helps, our VascuCare, and the other things, but the most important first thing, and by the way, this is for everyone out there. I don't care if you're a teenager and you're eating too many sodas, big gulps at the 7-Eleven, or you're having trouble with dyslipidemia and you're in your 20s, or your blood pressure is higher systolic or diastolic hypertension. You've got metabolic syndrome, and your peristaltic wave of your capillaries is already screwed up 20 or 30 years before you develop vascular disease, and you already have capillary and venule and arteriolar dysfunction caused by mitochondrial dysfunction through loss of superoxide dismutase and glutathione peroxidase. That's the facts. So if you're listening and you're a cardiologist, do you know how many of you guys can know how to measure the specific markers of oxidative stress, like 8-hydroxy-2'-deoxyguanosine, T-bars, and other DNA adducts? I think not. And you vascular specialists, how many cardiologists know about the Endopat and Endothelix and microvascular studies? I think not. And I think none of you know about the non-Newtonian fluid dynamics of rheologic blood flow and why it's tied directly to vascular disease. And that's why you knuckleheads need to listen. If you think you know more than me, please challenge me and prove me an idiot. Because I'm not. And I am trainable. If I have somebody with grade 3 with a better question and can train me, I have no intellectual attachment, as I've said many times, to my previous levels of stupidity. So that latest thing, and I have tons of literature. I read all the time on National Library of Medicine and other things like ReadMed Info. I got a ton of literature to prove what I'm saying, that your lack of superoxide dismutase and glutathione peroxidase is a primary driver tied directly to insulin resistance, leptin resistance, and peripheral thyroid resistance with increased levels of reverse thyroid hormone are all directly tied together. So Broder Barnes was right. Everybody with vascular disease is hypothyroid. Everyone. Everybody with vascular disease has metabolic syndrome. They all have dysfunction of their microcirculation. And that's why cardiovascular is essential if you don't want to die of a stroke, heart attack, or have your blood pressure go into orbit trying to compensate for poor circulation. You've got to maintain your microcirculation. So what do you think of that, Fareed? That's pretty exciting, isn't it?
That's, a very different approach to things that people here in North America think about, you know what I mean?
They don't think, actually. What I lean to convince people, and this is the primary thing, if I can get people to do one thing, don't believe anything I say. In other words, start off with thinking, this guy is an arrogant idiot, he doesn't know what he's talking about, and my doctor is God. No. What you need to do is you need to ask better questions. You need to challenge me. You need to get your doctor to challenge me. You need to go check the literature yourself. You need to see the articles I'm going to post up from National Library of Medicine. And when I get the experts on from Endothelix, they're doing research at universities in Texas and California and others in the southwest U.S. on Endothelix and Endopat, you'll realize what I'm saying is hard, indisputable science. And that I can give you the specific markers to prove you that the reason for heart disease is not cholesterol. It's 9-noronyl hydroxycholesterol. Cholesterol was proven not to cause heart disease. That's why chasing it will double or triple the risk of getting cancer and turning diabetic. So if your doctor says, like I remember talking to one doctor, he says, I give all my patients that are diabetic an HMG CoRe reductase inhibitor, or they'll give glipizide and all these other nasty diabetic drugs. What they find is the blood sugar drops, the hemoglobin A1C drops, and the patients go blind and go into renal failure because they don't deal with the underlying problem because they are knuckleheads. They don't know the parameters of the disease they're changing, and they're not monitoring them. They're chasing few numbers, playing what I call the numbers game. Numbers do not mean models. Models are different than numbers. Interesting, hey?
Yep.
So if you detect a little bit of what I call scientific and medical rage, you're correct. Listen up. The voice of medical truth is speaking. And I challenge you out there, if you want to stay well and not have a stroke, heart attack, or see your relatives die of cancer or other diseases, exclusively take NutriMeds like cardiovascular. And I believe every adult and any child with any illness should be on it. And anybody with detectable metabolic syndrome with elevated fasting insulin, elevated reverse thyroid hormone should be on cardiovascular.